Dr. Shawn Edwards. I would like to introduce our patient of the month. Dr. Heiler, Dr. Gadaletta, myself and the staff get compliments daily for helping people, and we really appreciate that. But it's time to start acknowledging the patients for their great work. You see, spinal conditions, extremity conditions, neuropathy, and most conditions don't magically disappear with a pill, a shot, an exercise, or even an adjustment. The symptoms may get better quite quickly, but the underlying cause is much more than the symptoms. Patients who do well understand this, and they take our recommendations, comply with our care plan, perform their exercises at home, and modify their lifestyle if necessary. The patient of the month is one person who's wholeheartedly taken on the responsibility as a patient to comply with treatment and made a difference in their life. Not only have they improved themselves, but they're an advocate now for a better lifestyle, and they brought many patients into our clinic for the same type of treatment. So with that being said, I would like to introduce our first patient of the month. Her name is Shirley Cotton. And you may, what I'd like to do, if you could, is just, tell what brought you in the clinic and how your treatment went and where you are now compared to where
I certainly will. I'd like to share with you what really brought me to the Chiropractic clinic. Several months ago, while I was walking my dogs, I sustained an injury. One dog wanted to go east, one dog wanted to go west. So consequently, I had a very serious injury with that twisting of my body. The next morning when I got up, I had severe back pain, leg pain, hip pain. I could hardly walk. So you can imagine how horrible this was. I called my internist at that time. I went to see him. He ordered an MRI and an x-ray that showed a protruding disc and mild to serious spinal stenosis. He did prescribe 3 different medications for me and told me to go to physical therapy, which I did for 6 weeks. I went there and I had some relief, but not the relief that I really needed. So, talking with my son, he says, "Mom, you need to go see a chiropractor." I said, "Who, me? Not on your life." Because at that point, I had very little balance. My coordination was terrible. I was stumbling over everything at the house. So 2-3 weeks went by. I thought, I can't live like this anymore. So I got on the internet and I Googled effective treatment for spinal stenosis. And I got the site of Dr. Heiler. I liked what I read. I read through the resumes and I thought, perhaps, still reluctantly, I'll just try them. I called for an appointment. Again, reluctantly, I came in. The girls gave me the papers. I said, I am not signing those patient papers until I see a doctor. I did see Dr. Heiler on that first visit. He said that with your condition, I feel that we can help you. On my second visit, I met Dr. Edwards. I was very impressed with his knowledge, his approach, and I felt this is someone that I can trust, that he really does care about his patients. With the adjustments and manipulations we had over the next few weeks, I did see little improvement, but many times I became very, very discouraged and think, why should I come back? I'm just not feeling the way I want to feel. Because you see, I always bounce back very quickly from surgeries or any type of other illnesses I had. But Dr. Edwards very calmly reminded me again of my condition. And even he has said, you are a clinical challenge for me. But with his endurance and patience and my commitment, I really did start feeling better. I had better balance, a different quality of life, better coordination, a lot more energy, and I really could see a big difference in my life. I'm so pleased with Dr. Edwards. I was very pleased with Dr. Edwards' treatment with me and the progress that I made. That I started started telling my friends. Anytime that they said, I've got an issue, I handed them Dr. Edwards cards, many of them which have become his patients. Not only that, I've been known to leave his cards at restaurants, and the other day, which he does not know about, I even left his cards at a doctor's office. It's true.
Yeah.
It is. But anyway, all in all, I'm just so pleased that I continued my treatment with him because I am a different person. I have a better quality of life, and I can do most exercises I want to do. Not only with his adjustments and manipulations, he truly believes in educating his patients. We have implemented a physical therapy program, which we do in the office and at home. And in fact, my house looks like a fitness center. And not only that, it smells of broccoli, of the energy drink, which he suggested. I have many friends who encouraged me to go to a pain management person, because that's what they do. They go and they have acupuncture, and they have epidurals. Guess what? They're still in pain, but I am not.
Thank you very much.
You're certainly
This is our patient of the month, Shirley Cox.